Welcome to Home Care, Doors Open, where we discuss licensing, operations, and scaling your home care business. Whether you're just opening your doors or looking to unlock new doors to growth and success, this podcast is for you. Let's begin.
All right, hello everybody. This is Lucas Carroll from the Business of Senior Care, and we're back with another episode for our podcast, Home Care Doors Open. Today, super excited to welcome a guest onto our podcast, Mr. Doug Walters. Doug is the managing partner for Walters Associates CPA. Welcome, Doug.
Thank you. Glad to be here. Really excited about it.
Well, awesome. Well, I want to jump right in. For our audience, I know that we have some inquisitive minds that are looking to get into the home care space, or maybe they're already in the home care space and they're looking to expand, or just learn more about expanding and growing their office. And a critical component of that is working with financials, working with a trusted partner in the CPA, doing monthly bookkeeping services. So maybe just start off, if you don't mind, just tell us a little bit about your company and then how you got into what you're doing today.
Yeah, sure. So I'll give you a little bit of information about me personally, and then talk about my company. So I'm a certified public accountant with a bachelor's degree in accounting from the University of South Florida and a master's in taxation from Villanova University. I really started off as a director of corporate compliance for a multi-hospital healthcare system, which gave me invaluable insight into navigating complex healthcare regulations. And from there, I started my own home care companies. So I had several home health agencies, started them from the ground up. And then as I grew my home care business, I actually bought and sold some home care companies. So I always tell my clients, no matter where you are in this flight, I've been there personally, right? So really happy I did that. I had a home care company, Medicare certified for a decade, and that really gave me the operational experience to help with my clients today. So not only do we help from the accounting and tax perspective, but clients often ask me things like marketing questions or things that are outside the accounting realm, and typically we've got some good insight there. So my firm today, Walters Associates CPAs, serves nearly 1,000 home health and hospices nationwide. So we're a full service accounting and tax firm specializing in Medicare cost reporting, strategic financial management, and we tailor our services specifically to home health and hospice, right? So we focus on that. And I have a registered investment advisory firm by the name of Walters Strategic Advisors, and we help our clients with retirement planning, helping them set up a 401k plan for their business, for example, and just some other things that go hand in hand with tax planning, right? So we always want to look at this with the end in mind. It's exciting when we're starting off, but if we think down the road, what's the exit going to look like? We want to be able to plan for that and have a fruitful retirement. So we help with that as well.
That's amazing. That's amazing. And just the unique blend of experiences that you've had in your life leading up to now to be able to speak real world advice to home health, home care owners is pretty unique. I'm curious to ask a couple of questions on that. Knowing what you know about operating, multiple home health agencies, if somebody, a listener, is thinking about jumping into the space or expanding in the space, or what's the potential opportunity of owning and operating an agency? What would you say? Like, what's the current environment from your perspective?
Yeah, I mean, it's always fun to get into, right? There's always some great opportunities in the home health and hospice space. When I got into it, I started off in 2004, started my first one, and had that for about a decade. I divested it in 2014. And I can remember when I started it, hearing people tell me that it was saturated. The market, I'm getting into it a little bit late. And we did very well for that decade. And I can tell you today, looking at our clients, we've got clients all over the board, of course, but we have a lot of clients that are prospering very well in home care. So I think the number one thing is, starting off. Now, if I were to do it all over again, and as I look back at the success we had, it was because of our referral sources. So I think having a solid referral source, or at least some partners that can help us from that perspective, makes it a lot easier to start, right? So maybe finding the right medical director or leader that can give those referrals to us, or knowing someone that's in the industry that can bring a marketer, for example, that can bring that business. I think that's critical to get started
Yeah.
because it's not easy, right? Typically we're not reinventing the wheel here, right? We're not starting something from scratch. We're taking a patient from someone else, right? So it's a matter of having the right referral sources in place and and the right service levels.
Absolutely.
Yeah.
Um, and you see with the 1,000 or so clients that you have, interested in your perspective on the question of, is there a right pedigree or mix of an individual who owns a home health agency, their makeup as a person? Like, is there one traditional way? I think I see home health owners coming from all walks of life, but what do you see from your end as far as successful operations and kind of who the leader of that operation is?
Yeah, I agree with you. You do see everyone, all types of individuals that are agency owners now. I mean, from the CNA who worked in hospitals and home health, and all of a sudden, had the passion and wanted to start their own company, who is new to the business, right? New to the business in general. We have a number of those clients too, seasoned business leaders who just want to get into something different in senior care. It just is that feel good business, right? So we've got those types of clients as well. So really, there's no perfect person for this, right? It's all over the board. I think if someone has a passion for working with the elderly and seniors, and we also have some that work with children as well, right? So
Yeah,
having a passion for that healthcare environment is the right person.
absolutely.
Yeah.
Absolutely. Now, from the financial and CPA perspective, if you're, advising a new owner or an existing owner who maybe has worked with a different firm previously, what are some of the things that are like the foundational building blocks to set up, from the beginning, from financial reporting, bookkeeping, that sort of thing, that can help you to lay the foundation for a successful operation?
Yeah, I mean, this is going to be probably a little bit biased, but I always say, work with professionals that are in the industry, right? So whether they work with me or you or anybody, you have to ask certain questions of the professional that you're going to work with, and the first one I would ask is how many clients do you have in this industry? Can you give me references in my marketplace? Those are very important because I think we come across, especially in the licensing arena, as we do some of these specialty license applications, sometimes the CPA will help a client get through the process, but then they get denied. And it's not because the CPA did bad work. It's because the CPA just didn't have the experience in healthcare. And you've got to understand what the state is looking for example, right, on the applications. In Florida, is very regulated where we sit, and we help clients in different states, obviously, but Florida is being one of the most regulated states. The state has nuances. For example, you can't show more than a 15% profit in the first year of operations on a projection. Now, there's no accounting guidance that supports that, but that's just what the state allows. All right, so you've got to understand that and have that understanding of what the state requirements are. And if you haven't worked in healthcare or worked with these states in the past, you're probably not going to be successful. So while the CPAs may be very good at what they do, like I said, if they're not in the space, it's a struggle.
Yeah, I think that's a really important point, just working in Florida as well. I think that sometimes, we're working with clients and then connect them with professionals like yourself, that it's a bit of understanding what the state regulations are and what they want to see, and formatting a financial projection in a pathway that follows all the guidelines. And then, having just a sense of your financial projections on maybe what you want to do as an agency, what you truly want to do. If you want to make more than 15% profit in your first year, that you are still keeping that perspective open to.
Yeah, for sure. And we've seen it happen. It's not that it can't happen, but the state won't allow it in terms of a projection anyway.
Yeah,
Yeah,
absolutely.
yeah.
Um, well, good. As you look into, the some of the like regulatory environments, some of the changes that we see are coming in payer sources like Medicare and Medicaid and Medicare Advantage and other insurances. What do you think that impact will look like for home health, home care owners that are looking to balance their payer mix and still have a profitable business?
Yeah, it's always a struggle, right? It's always reduced reimbursement, right? You never really see it go up too much. I mean, you might see a little bit of a market inflation allowance, but it's not ever significant. So you're always balancing reimbursement with your expenses in the business, right? Is very important. So we had a client just the other day. We do some mastermind programs where we put some of our clients together from across the country in the hospice space, in the skilled home health space, and in the non-skilled home health space, so that our clients can communicate with each other. And yesterday we had one, and the issue came up with a hospice provider who literally had a 0.8% increase. So but yet their salaries are going up 3 to 6%. All right, so how do you manage that as an agency? And so we talk about that collectively as a group, and really getting creative on salary, right? So we look at our expenses, because you got to manage your expenses. So if you're not having a very good reimbursement increase, then you either increase your volume, right? Get more patients, right? So marketing efforts, or you decrease your cost. And so when you're up against recruiting and retention issues with other agencies and trying to find these people that we're all struggling to find, how do you stay competitive at the same time and be fiscally responsible? And so we came up with some ideas and talked about the fact that if you're going to give an increase, perhaps if in this case it was a 3 to 6% budget is what they were trying to do on the salary side. And by the way, we all know that salaries are your biggest expense for any company, right? It's going to be for a home health company 60% of your expenses. So certainly something we have to keep an eye on. And what we talked about was, look, if you're going to give a 6% increase, which is very aggressive, right? But this particular provider was in California, which is a high salary state, and trying to maintain their competitive nature there. So how do you do that? And we talked about, look, maybe you don't give the 6%, maybe you give a couple percent as a budgetary inflation factor, right? And then you give a bonus, right? So you do it through bonuses where you're not compounding on that expense year after year, and it gets out of control, right? So that's one way. And we just talked about other things like that, but I think it's just a matter of getting creative with your expenses. You've got to be creative in a lot of places.
Absolutely. Absolutely. It's really interesting to hear a CPA professional to talk about the flip side, which is to increase revenue.
Yeah.
You typically hear just the expense piece,
Right.
which you were just talking about for the labor, but you also mentioned that it can happen two ways. You can increase revenue and also decrease expenses. What are some ways, I don't know, in the mastermind group or with clients that you've worked with to say, hey, have you thought about increasing revenue? Who hasn't? But here are some ways that you found successful for your agency, or you've seen other clients.
Yeah, I actually put something together. We have a guideline and kind of a manual that we put together on marketing, and I'm happy to share it with your audience. No problem. But I think we put together, I forget how many ideas we put in this thing, but it's a lot of marketing ideas, and some of it's obvious, right? Like, hey, make sure your website is up to date and you've got certain things in there, and a lot of it's like, okay, yeah, that's obvious, but if you're not checking the box and saying, yeah, I knew I had to do that, but let me get to it and do it, right, and take care of some of these things. So a lot of it's that, but there's also other things in it. And I tell clients, listen, even startups, you're always hiring marketing people, right? You're always looking for marketing people. And I've gotten pushback from clients who say, listen, I can't afford a marketing person right now. I'm just starting up, and we're barely breaking even. And my response to that is, you can't afford not to hire a marketing person at that point, right? Because with hiring a marketing person, that marketing person, excuse me, ought to support themselves, but ought to also significantly increase your business, right? So if they're not doing that, they're not going to be around very long. And mistakes I see providers make is, when you sit down with a marketing professional, they'll sell you the world, right? I'm going to bring you 30 Medicare patients a month, no problem. And 6 months later, 8 months later, you've gotten one or two, and you've paid $75,000, $80,000 out at that point, right? So it gets very expensive. So we always say, listen, you have to have a ramp up, right? And so let's say, for example, we said, we bring a marketing person in and say, okay, well, what can you do for me? And they say, well, I can bring in 20 a month. Okay, great. For the first 3 months, I want you to bring in 5. because you ought to be able to do that without a problem, right? We want you to ramp up. It's going to take some time. The next 3 months we'll go to 10, following 3 months 15, and then eventually 20, right? And it doesn't have to be these numbers, but something similar to that. If they're not getting to those baseline numbers within 60 days, and let's say they haven't brought anything in, or they brought 1 or 2 in, then because you set those things up, that discussion up front, that it's an easy discussion with the marketing person at that point. Like, we gave it a try, it's not working. We're not. I don't think either one of us thought we'd be where we are today, so we're gonna have to end it. So it's an easier discussion because it's hard to let people go, but at the same time, you gave it a shot and you only did it for 60 days. So if you're hiring someone for $80,000, you only really spent a few $1,000 for whatever time they were there. But when you do get that right person, that's going to be a game changer for you, right? So we're always constantly looking for that right marketing person.
Yeah, that marketing person for sure. I mean, that's got to be one of the most stressful for an owner of an agency to decide to pull the trigger or not pull the trigger, or especially when they're around the break even mark. And you must see that from your side, like, hey, I just don't know if I can do it. I don't know if it's going to result. I could have to eat these expenses, and that's got to be a very nervous time period for an agency owner.
It really is. And one of the things I'll say about the marketing side is you're never allowed to pay for patient referrals. And a lot of new clients will come in, and new home care companies never really kind of understood that, right? So you got to be very careful on who you're taking to lunch, how many lunches you're buying for somebody. There's de minimis rules there, but you never want to pay for a referral, and you've got to stay clear of those rules. But the one person that you can pay, so you can never pay a physician for referrals, but the one person you can pay is the medical director. So if you have a medical director that's overseeing your agency, that's typically exempted from those requirements. And so, we were fortunate enough to find a medical director when I started my home care companies that supported the agency. Now, that's not, I want to be clear here that it's not, conducive to them being medical director that they have to refer it to us, but finding that right partner, you hope that you find the right doctor that's gonna support your company, right? And so that's a critical hire when you are looking at bringing on a medical director, who that person is that can really, hope support you as well.
That's a really good. I haven't done that. That's really good feedback.
Yeah.
Yeah. Just one last question, kind of as we wrap up. For back to just tying it home for your organization and working with home care, home health agencies. And looking for the right foundation of financial success as you grow your agency. What should you be looking at on a monthly basis? If you're an owner operator and you have revenue and you have expenses and you're trying to manage all of everything 24/7, but looking at your financials on a month to month, and then as you get through the year, what are some important things to be looking at that you can help to key into your business to make sure that you're financially healthy?
Yeah, we look at financials in a number of different ways. A typical firm will, prepare the financial statements and send the clients the financial statements on a monthly basis, right? And 9 times out of 10, and from the feedback we've heard from clients who have left other companies and have come to us, which is all of our clients, right? Let's face it, except for startups. We hear this story of, we never got our financials on time. They were always late. Even if I got them every month, it was usually a couple months behind. So you're always looking over your shoulder at your financial data. And so one of the things that I like to do is look at it in real time. So the way that we work with our clients is we're preparing financial statements on a daily basis. So every single day, those financials are up to date. When we meet with our clients, and depending on the service levels, we'll meet with them on a monthly basis. We'll look at the financial statements, but we line them up on a month-by-month basis. Because if you're looking across, let's say now we finished through June now, right? Because we're in July as we sit in this podcast. And so the first 6 months of the year are done. So if you line up all your months and look across all 6 months, you can see very clearly, each expense category and what the changes were throughout the year. And so I love to look at financial statements that way because it's easy to pick up big nuances, big variances. So you can see it very clearly. The other thing that we do is we put the financial statements in this key performance indicator report so that we can provide metrics to our clients and say, let's project forward. Rather than looking over our shoulder, let's look in our windshield instead of our rearview mirror and say, where are we headed, right? And what levers can we pull based on this financial data to get to the next level? So that's important by looking at KPIs and measuring against certain metrics to see where you're at and where you can improve. So, for example, we talked about salary. Most providers are at the 60% mark, and if you're north of that, that might be something we need to look at. Maybe you're heavy on overhead. What is your other administrative expenses at? If maybe they're at 20%, and then you have a 20% profit is maybe one of the goals. So if you're higher than that in the other administrative and general expenses, maybe we ought to look at that. And really looking at every single expense. So many clients have offloaded their AP, and they lose sight of every single thing, right? They're not looking at the detail enough, and before you know it, you might be paying for users on your software bill that don't exist anymore, right? For example, and we see that a lot. So just little things like that, but don't be too quick to give the checkbook away, right? Just keep an eye on every single expense that goes out that door, especially in the startup phase where it's critical.
Absolutely, perfect. That's a perfect way to end on that one. Thank you. I want to thank you, Doug, for your time and sharing your wisdom, experience, and expertise with our audience, and just sharing with us. I appreciate it.
Absolutely, Lucas. Happy to do it. Thanks for having me.
All right. Yeah. Thank you again to Doug Walters, the managing partner for Walters Associates CPAs, and thank you. Have a great day.
You too. Thanks.
If you found this conversation valuable, please leave a review on your favorite podcast platform. Also, be sure to like, comment, and subscribe to our YouTube channel, The Business of Senior Care. We'll see you next time on Home Care. Doors open.